Okay, guys. So it's Tuesday again. It's the 7th of June, and I'm about to do something that I've always wanted to do, and that is to present a patient with that comes to see me for chronic bacterial cystitis. And so I have this patient today, and she is from. Where are you from, ma'am?
California.
What part of California?
San Francisco.
Okay, so she's from the Bay Area, and she's 39 years old. So, what can I do for you? What kind of problems are you having that you think I could help you with?
Yeah, so I've just been dealing with what feels like to me is a UTI. I've had UTIs, when I was younger. Obviously, when I started becoming sexually active, I had quite a few, and so I always known kind of what that feeling is. About 3 years ago, almost 4 years ago, I developed what I thought was a UTI. Went to the doctors. They did the whole lab thing. Everything was negative and clear. And I was like, what is this? So I started drinking water and taking, cranberry juice and azo and all that. The feeling never went away. I went to the ER. I thought I had like kidney stones. They were like, no, it's not that. We're going to refer you to a urologist. I actually got referred to a urogyno. She did a cystoscopy.
And when was this exactly? Say 3 or 4 years ago?
This was 4 years. This was in 2018.
Okay.
Actually, back in November of 2018.
2018. That's when it started getting really bad, I guess, huh?
That's when everything started, yeah. That's when I thought, oh, I have a UTI. I must have got a UTI from my partner. And I was like, oh, they're going to give me antibiotics and this is going to fix me. And then I was shocked to know that it wasn't a UTI. And so from the moment that this feeling happened to when I say I went to the urogyno was probably within a week.
So you went from 0 to feeling like you had an infection in a week, and you were sent right to a urogynecologist?
Right. I was sent because I was so, it was like I went to the doctor, and then a couple of days later they said like the culture was negative, and I still felt like something was wrong. I went to the ER, and then I went and saw the urogyno. So it was all pretty close together because I thought something was going on. I really thought I had like kidney stones, right?
Okay, but let's go back for a second. So you said that for many years you'd had infections periodically. Were they a nuisance, like recurrent infections like every few months, or were they like 1 or 2 a year?
I would say not even that. I'd probably say maybe like once a year. And then sometimes because I knew what a UTI felt like from like obviously the very first one, I would always know, like I always read about how to prevent it, right? So it was like at the first sign of symptoms, you drink a lot of water and try to flush it out is what I would say. And so as far as having like a real, like in my medical history, how many UTIs I've had, I probably only had maybe 3 or 4.
Oh, wow.
That I know of.
Okay.
It's not something where, I've had,
yeah,
I get infections every month or even
every year. Right. So this is a really interesting case of a lady that knew what a UTI was, and then all of a sudden, 3 or 4 years ago, it consumes her. So you went to the urogyno, and they said what?
They did. She did a cystoscopy, and she comes back. She's like, "Well, I think what you have is something called it's IC, it's interstitial cystitis." And I was thinking at the time, like, "Oh, great! Like, where's my medicine?" Like it's I was so happy for that term because I had no idea what IC was, and I thought, "Oh, this is perfect! Like, we found the problem. We found the root of it." She gives me this paper. She's like, "Try this IC diet. Don't look online too much about IC because you're just gonna get, worried and freaked out about it. And you should also try physical
Okay. So you're telling me you went from 0
Mhm.
to a week later getting a scope and a diagnosis of interstitial cystitis. Is that right?
Yeah.
Wow. Okay.
Yeah.
So there clearly we can all see a problem there. That's no good. Okay, so you get this diagnosis, you get scoped, and what happens next?
I mean, I was just suffering, you know. I was a mess because I was like, oh my God, what is this? It wasn't, the feeling wasn't going away. I particularly had the urgency and frequency.
Yeah.
I didn't have so much. I know a lot of people have like the burning and the pains. I didn't have all that, thank goodness. I just had, for me, it was a lot of urgency and frequency, and then it kind of manifested into, I felt like I was having some, like, a little bit of pelvic pain with it.
Where was that pain?
It was more, the pain was more like it was more like vaginal pain.
Mm-hmm.
You know, just like like a soreness.
Uh-huh. Did you notice it in the lower abdomen at all?
No, not that I can recall at the time,
Mm-hmm.
no.
All right. And so you were having frequency and urgency. Were you getting up at night to urinate all of a sudden?
Oh yeah, it was like all day, every day, all night.
Yeah.
Like, when is this gonna end?
Mm-hmm.
Taking a lot of azo, just any pills that I had. You know, I've had like backaches before, so like muscle relaxers or naproxen or you name it.
Did any of that help?
No, I think if anything, it might have just helped maybe to calm me or like have me go to sleep. You know, to
Yeah.
kind of like what I was feeling.
Did-
It didn't really help.
Did you notice that you started having more trouble urinating, like slow stream?
I feel like I did have a little bit of a slow streak, but I don't know if that would be attributed to the fact that I wasn't drinking so
Uh-huh.
much water, too. You know?
Okay. Did you feel like when you would urinate that you were empty when you were done?
No, I mean, it's something where, I mean, even right now, like as I'm talking to you and I'm like in this flare that I've been in, it's like I get relief maybe, you know, for 5-10 minutes after
Yep.
I urinate.
Yep.
And then it's like,
Yep.
oh, I have to go again. And
Okay.
everyone's like, oh, you just go. And it's like, well,
Yeah.
for what? Nothing's going to come. I'm not going to urinate anything.
So before this episode, you didn't have any trouble with intercourse, is that right?
No, I was just a healthy.
No pain.
person.
No pain with intercourse. Intercourse was fun. And then all of a sudden, did you notice that intercourse started to be a problem?
Yeah, a huge problem.
Okay.
I mean, I mean, I could even think back to like the months before that happened, and like just what a difference like my sex, like it has affected my,
Mm-hmm.
you know, just intimacy, because it's like when I am uncomfortable, I obviously don't want to be intimate, and then when I'm fine, it's almost like I'm so scared that it's going to cause
Yep.
a flare, so it's just.
Yep. It's yeah. Okay. All right. So let's go. So what did they do next?
So I remember next it was just like that was I think in October, November, and then I was like in misery for a couple months. I went and saw a pelvic physical therapist.
How did that go?
You know, I mean, I want to say like that wasn't helpful in a sense to kind of calm things, but it didn't get rid of anything. And I don't know if it's always hard for me to tell, like, did that help me? Because it would work for, like, I would get out of a flare and I would think like, oh, this was gone. I remember I would travel around New Year's and I was like, oh, because at that point I was just like, oh, this is just my life, you know. I just have to like deal with this, and you know, I have to work, and I can't be curled up in a ball and cry about it. And it would go away for a couple weeks, and then it's like it would come back.
Yeah.
And then go away, and that's been the pattern.
Could you tell it was related to your menstrual cycle any?
You know, I haven't. For me, no, I don't. But I haven't really tracked it, so I don't know, and that's a good question because.
Well, a lot of people notice it like, to the minute. As their hormones change, their bladder symptoms change, and not everyone's like that.
Right, yeah. So for me, the biggest thing, since 2018 when this first happened, up until the present day, I mean, any treatments that I have was like, okay, I would feel like I'd be in a flare and I'd be like, oh, let me go try this physical therapy. And
Yeah.
so many people praise that the physical therapy works that I thought, well, maybe I have like I'm seeing the wrong person, you know?
Yeah.
So
Well, I think that usually what's going on is that you're so irritated and your pelvic muscles are spasmed up. It's a secondary response, So I don't, I think that there's a role for it, but it's a secondary response. So,
right,
all right, so we tried a little physical therapy. Did anybody ever let's give her some antibiotics and just see? I mean, it sure sounds like a UTI.
No, nothing. I mean, I didn't even know. I honestly, once they labeled me with IC and I read about it, the thought that this could even be a bacteria. I mean, it wasn't until I found just people online in different groups that were cured with obviously this type of treatment and saying that it could be embedded infection. I would have never known if this would have been the day of no internet, and not like it is today. I would have never.
Okay. All right, that's a good point. So during all this time you're having this severe frequency and urgency, did they give you any medicine for frequency and urgency?
So finally, after, try more physical therapy, and just on and off with that for years, I did try at one point, like overactive bladder, try.
Which medicine did you try?
Myrbetriq.
Myrbetriq. How'd that go for you?
I didn't do nothing. I mean, I tried it for like a month, and I'm not, I don't also love taking different pills like that. So for me, it was like, and maybe I didn't give it enough time, but it didn't do nothing.
You tried it for a month and had no response.
No, it didn't have no response.
Okay.
And then I got pregnant.
Okay.
And obviously didn't want to take anything.
Yep.
And lo and behold, like the symptoms kind of went away.
Yep.
So all of last year, because I got pregnant in January of 2021, so pretty much all of last year, like I was great. And then my baby was born in October, and I was like, oh my God, maybe this like got rid of it. Like I wasn't even thinking about this whole issue. And then boom, come January, I just came from like one day to the other. I think I went to the bathroom, and that's how it always happens with me. I don't ever know what triggers it and what doesn't. It was just something where I went pee, and then it was like 10 minutes later, oh, I have to go pee again. And I was like, oh, great, here we go.
And when was that? March of this year?
That was in January.
Oh, January of this year.
Since January, yeah. The way I've been feeling has been. So I called the doctor, the urogyno, and I said, hey, this is back. Like, what am I supposed to do? And so that's when we tried the bladder Botox, which I kind of regret doing, and that didn't do nothing. That was in the last few days of January. I mean, it's been almost 5 months now, and that didn't have any.
So you had no response to Botox?
No response to the Botox.
Uh-huh.
And then the only other thing I had about a month ago, I saw a doctor, which is, it's funny because I've seen one urogyno, I've seen quite a few different urologists.
How many urologists have you seen?
I've seen 1, 2, 3. I've seen 4 urologists and 1 urogyno.
Okay. Did they do any kind of X-ray tests or anything?
I did have, and that was a couple years ago. They did, I think, an MRI, I believe, on my pelvic. Because I thought, oh, maybe I pulled a muscle, because I used to always work out. And everything was clear. That's the only, as far as testing that went.
Did they ever do any urodynamic testing?
So, about 2 or 3 months ago, I was kind of like, I'm going to be on a mission. I need to advocate for myself. I need to see anyone, everyone to find out and get different opinions. I just didn't want to get sent to like more physical therapy. And so, I saw a urologist. He actually tried. He doesn't believe in the IC, like that term and that diagnosis. But he doesn't say anything about like an infection. He thinks it's the pelvic floor. He tried 2 rounds of pelvic floor injections. I don't know what kind or what kind of. I don't know if it was like a steroid. I mean, I had relief for like a day or 2, but then that was it.
Was that done in the office?
That was done in the office, yeah.
So he injected it like transvaginally?
Yes.
But you don't know what it was?
No, I think I have the name written down somewhere. I know it was just probably like I'm assuming like a steroid, right? Or something.
Gotcha.
Like pain.
Cool.
Yeah.
All right.
Um,
So that was a very short-lived response.
that was a very short-lived response.
Gotcha.
And then about a month ago, I got seen with it was a urologist. I don't know if she's like an IC specialist up in UCSF, and she did. She wanted to do a cystoscopy and a urodynamic. And I was like, oh, let's just do this urodynamic. I've never had that done. Obviously, everything was clear. Everything was clear. I just want them to find something, right?
Yep.
Nothing in the urodynamic. And she wanted to do a cystoscopy, which I was kind of like, I didn't want her to do it again. Because I was like, I just had the bladder botox done in January. I would think that the doctor would have saw something. And she wanted to do it, and it was really quick, and it was fine. But, of course, she didn't see anything.
She said it was normal.
She said it was normal. And everything was normal, and my treatment plan was pretty much physical therapy. She thinks more pelvic injections, and there a list of different vitamins to take. I mean, I don't remember. She gave me a whole different ones to try. There's like the Cysto Renew. I don't even remember. So she gave me a list of ones to try, and that was about a month ago. So it was kind of like, just kind of getting bounced around the system.
Yeah.
Much.
Okay. But never during any of this time, did you ever get a DNA test done?
No, I mean, the only testing I have ever had done in these past, 3.5 years has been, is just the 2 cystoscopies, a urodynamic, lab test. Oh, I will mention that I saw a urologist because I heard about microgen, obviously, through all these forums, and I found it, ironically, the hospital that I had saw one of the urologists offered the microgen test, and so I had to bring it up and say, hey, can I get this microgen? Like, what is this about? And they ordered it for me, and it did come back with the Enterococcus faecalis, I believe, really high.
Yeah.
2 other things. And then I was, like, excited again. This was about
Of course.
3 months ago. Wow, this is it. This is what's causing all my issues. They prescribed me a week of Augmentin. That was the first time I had ever taken antibiotic. But they just gave me a week, and it didn't do anything. And
so no response.
No response.
Okay. What about during these past 4 years? Have there been numerous urine cultures that were done that were negative?
Yeah. So I'm assuming they were all negative because no one ever told me anything. But every time I would go to go see like any of the urologists for these appointments, they would tell you to leave the lab samples. So,
okay. And did they always tell you that your urinalysis was normal?
Yeah, I mean, honestly, like, I never got a call saying it was either or, but I always assumed that it was normal because, no one ever said,
okay.
Urine this, yeah.
So I think that kind of gets us caught up to date. And so we know your history now. We have a urinalysis here that's normal. It's a dipstick, and it's normal. No blood, no pus, nitrites are negative. So this is a pretty typical story of chronic bacterial cystitis in a patient that is young, healthy, no problems, really no medical problems at all. And all of a sudden she has this catastrophic diagnosis of interstitial cystitis. So what we're going to do is, now that we have the complete history, we're going to do some DNA testing, and even if those DNA tests are negative, I know by talking to this lady, I know this story, and I know based on prior experience that these symptoms are coming from a bacterial infection in her bladder lining. Okay, that's just what causes this. There's no other entity that's going to cause these symptoms other than something like bladder cancer that we know she doesn't have. She's been scoped multiple times now. She doesn't have any blood in her urine. Radiation cystitis can cause similar symptoms. She hasn't had radiation. She hasn't had cervical cancer. She hasn't had endometrial cancer for her to have radiation cystitis. So she doesn't have that. This bottom line here, this is chronic bacterial cystitis. She has frequency, she has urgency, she has pain. She has pain with intercourse. This is classic chronic bacterial cystitis. So what we're going to do is we're going to send off her urine. We're going to call her when we get the results. We're going to start her on some antibiotics, and we're going to be patient. This is going to take time. This is a lady that's had an infection for 4 years. She's had an infection for 4 years that's been untreated. So do you think you're going to give someone an antibiotic for a week that's had an infection for 4 years and clear it? Absolutely not. And this is probably a 1 to 2 year project to get her well. Hey, I don't like it. I don't like having to give somebody antibiotics for 1 to 2 years. I don't like giving some antibiotics to somebody for a month. It's not good. It's not great antibiotic stewardship. I get it. But until we get the resources and the research done to figure out what's a better treatment, this is what we have to do, because our number one goal is to make people better. That's why I went into this. It's cool to take somebody that doesn't feel well and make them feel better. So that's the story today. We're going to be updating this video through her treatment course, and what we plan to do is call her in some antibiotics when we get the results. We're going to start seeing her on a quarterly basis, usually about every 3 months. And every time we talk, we'll be monitoring her progress, and I'll post it on the YouTube channel. Should be very interesting. I've told her she's going to have to be very patient. There's going to be good days, there's going to be bad days, there's going to be good weeks, there's going to be bad weeks. But she's going to find that over the next year, her symptoms are going to gradually improve. Her frequency and urgency is going to get better. She's going to be able to have intercourse. It will be enjoyable again. It will not be, she will not dread it like she does now, and I look forward to taking care of her. Y'all have a good day.